My name is Nicole Bumgardner. I'm a health promotion specialist at Penn Lancaster General Health. I work in the Community Health and Wellness Department. Most of my role pre-COVID was connecting our patients to social services, and my current role with COVID is to help originally with testing when we first started COVID, and then I actually moved into developing pop-up clinics for hard-to-reach or hard-to-access communities. I actually had family members. My father had COVID at one point during Thanksgiving, and it was pretty scary for a little bit. He didn't have to get hospitalized or anything, but it made it pretty easy for myself and our family to decide to get vaccinated in the long run. So I had the opportunity to be vaccinated a little bit earlier, as well as my mom, because she also works in the healthcare system. But for me, that was great because I had that opportunity to kind of speak from where my family was coming from on a personal level to the community. So I've used that opportunity to work with the community and have those opportunities to sit down with them, talk to them about what their concerns are and how I could help them. So that's been my main role, and I continue to do that with Penn Medicine LG. But the time where we kind of built resiliency was in that second phase where we were all kind of tired, and we was just kind of like, okay, maybe one more cup of coffee, one more late night, one more sit down with a community member or community leader. And that's kind of how we built that. I was very lucky to have a really great team that I work with at the hospital, and I have great doctors that support us. That was kind of what helped push me through, just the knowledge that, like, if we do all these things, if we get the vaccine, if we wash our hands properly, if we wear a mask, if we do all those things, we can get through this. We know that disproportionately that individuals of color are affected more by COVID-19. We have more health disparities that we often face. We have more social determinants that we often face just because of past history. The idea and the importance of being vaccinated as a person of color is bigger than ever. It's kind of one of those things that what we can do to protect our own, what we can do to protect our families, our friends, our community, because we want to continue on this path that we're going on. We've already had a pretty difficult year with other things that are going on in the community and in the world. My call to action would be simply, if you are vaccinated, talk to your friends who aren't. Be reasonable when you have that conversation, be open, be willing to listen to what their concerns are, and have and obtain that knowledge. So know where to get that information, know where you can go that is accurate, real-time information for you to have an understanding of what actually is in the vaccine, what the vaccine does for you, how it can save you, and just really take that ability to work with your community, your friends, your family, your neighbors, to really have those conversations with them, because it's more important than ever to get vaccinated. So that would probably be my biggest call, is get information, make sure you're getting accurate information, and talk to your friends and family that aren't being vaccinated.